It's World AIDS Day, a day to take stock of how far we've come and what still needs to be done. South Africa has been at the epicentre of the scourge, with more than 5.5 million people still living with HIV, or roughly 17% of the adult population. We're still home to the largest epidemic, but South Africa has the largest treatment program in the world, and that is yielding results. We've adopted the Unaids target of having 90% of the population know their status by 2020. So what has, could and should the role of South African business be? To discuss, we're now joined by the former CEO and now board member of the SA Business Coalition on Health and AIDS, SABC, and that's Brad Mears from our studio in Durban. Good evening to you, Brad. There's talk that we've reached the beginning of the end of the scourge. Is that true for business in South Africa?
Good evening, Francis, and good evening to your viewers. I hope that it's not the beginning of the end. I think that there is still a very long path to follow. I think that whilst the government has done some remarkable work and has done some exemplary work in putting many more people onto treatment than what we were looking at, say, 10 years ago, I think we need to acknowledge that the behavioural trends underpinning the epidemic and the social drivers that are continuing, the unacceptably high levels of stigma and discrimination, and concerns around sexual behaviour amongst our youth are things that I would argue are not receiving adequate attention, and I think the business sector could play a significant role in those areas.
Well, what is the role of business right now? I think testing is so important because we know, I think Unaids saying today that less than half of the people who have AIDS even know it. So is that a really important role, because you can do the testing at the workplace and create a conducive environment?
So I think the workplace has got a very significant role to play, but it only takes you so far. I recently wrote an article about having functional workplaces that reside and exist within dysfunctional communities. And I think that business leaders need to reach out much more proactively to government, and indeed vice versa. I think government can do a better job in reaching out to business, in making sure that the total environment within which we operate is a lot more functional. It's one thing to have a strong balance sheet, but it's a very different thing to have that strong balance sheet residing in a community where the levels of social capital are very low. So I think we need to look beyond the manifest initiatives such as testing. Those things are good, but they only take us so far. An employee can test today and become infected with HIV tomorrow. And if we're not going to really understand the deeper social drivers of the epidemic, then I think that we are really throwing good money after bad. And so what we need to start doing is educating our leadership within the business sector for them to understand that HIV is more than a medical issue. It's more than a biological phenomenon, but rather there are some very distinct social drivers underpinning the epidemic. And if we want to reach that 90% threshold that Unaids has set, then nothing less than a very functional public-private partnership between the business sector and government will do.
Well, are these happening? Last time we spoke about some of the partnerships and initiatives that SABC was involved in. Is anything that you're suggesting actually happening on the ground?
I think there is some stuff happening on the ground, and I'd like to think that SABC has played a pioneering role in evolving some of those public-private partnerships. But in proportion to the size of the epidemic, the number of public-private partnerships that exist are very, very few. There needs to be public-private partnerships taking place at all levels, starting with basic understandings between workers and managers at a shop floor level, and elevating itself right up to partnerships taking place between the business sector as a sector within society, and government, and the NGO sector, for example. And I think that there was a recent pledge that was signed by SABC, the Department of Health, the South African National AIDS Council, and the Presidency for Mpumalanga. And I think that heralded for me a breakthrough in the development and the strengthening of partnerships at a political level between the government and the private sector. But I think that what needs to now happen is that actions speak louder than words. And we now need to start seeing how political affirmations and coming together can now translate itself into very, very practical public-private partnerships happening at a grassroots level.
Brad, what are those practical public-private partnerships? Because you said testing is not enough. You're alluding to education, looking at living conditions. Just tell me how business really should be intervening in a practical way.
So I think if you look at the byline that underpins the existence of SABC now, it talks about healthy communities and healthy workplaces. And I think that if business is going to be parochial in its view and focus inwardly on simply looking at the workplace, I think that, and I would argue that that's a particularly myopic view to take. Business leaders are traditionally not good at social engagement, and they don't understand the mechanics of how to engage with broader society. And I think that there's perhaps an education that needs to start taking place amongst our emerging leadership. I would look to our tertiary institutions to start developing a cadre of leaders that come out with qualifications that make them capable of being able to understand the social science of our country.
All right, so it's what happens when you go home as well. Brad, I have to stop you there. Absolutely. I wish we could chat further. That was Brad Mears from the SA Business Coalition on Health and AIDS.